All right, let's just wait 15 seconds for folks to get on, and then we'll start. All right, hello, I'm Colonel Michael Greenberg, the Fort Belvoir Garrison Commander. Thank you for joining us today for the 7th weekly Facebook virtual town hall. I'm joined today again by Captain Cindy Judy, the director for the Fort Belvoir Community Hospital. We take this opportunity each week to give you an update on areas on the installation, both at the hospital and across the installation, but we also answer any questions or concerns. The feedback I've gotten so far is that I believe the community likes these updates, so we will continue to do those for the foreseeable future. We have not changed from last week as far as our health protection condition. We're still at HPCon Charlie. Today is our last day in April, and so over the month we've recognized 5 significant observances: alcohol awareness, child abuse prevention, sexual assault awareness prevention month, volunteer appreciation month, and the month of the military child. I want to address the first 3 that we recognize this month, and it was some of the high risk behaviors. And so some of these high risk behaviors could be directly related to the conditions that we are on right now. So we have social distancing, a lot of closures across the installation. We have stay-at-home orders, and we have folks that are in a confined location for a long period of time. It's been well over 6 weeks, and so I ask you just to look at your behaviors, any high-risk behaviors. Please recognize those, and if you need help, please, we have the resources on the installation to support you. If you need help in those high-risk areas, you can call the ASAP office at 703-805-1083. Again, 703-805-1083. I encourage you to follow them on their new Facebook page at Fort Belvoir ASAP. So we also recognize the month of the military child this month, and we talked about it last week in our town hall. But also, if you go into our Eagle that was released today, and you go to page A7 or A6, you'll see we outlined some of our CDC workers and what they're doing to really impact the community. And so I want to take a moment to especially recognize those CDC workers. We had 62 that have been working day in and day out to provide that service for our COVID-19 essential childcare programs at our CDCs and our school age center. So again, thank you for what you're doing. You're making it easier for our mission essential employees to do their jobs. And then finally, each week I've talked, as we've had positive cases come up, we've been very transparent with the community. And we did have another one come up at the start of this week. And so this week we had an employee at one of our food court restaurants that tested positive on Sunday. And so again, the questions have come up, well, what do we do in a case like that? And we do what we've done on all the other cases. You know, first, we thank the employees. If you don't feel good, you stay at home and you seek medical care. And so in all of our instances, that's what our employees have done. And so they felt sick, they got a test, they stayed home. The test results came back on Sunday. We immediately closed down the facilities that was in question. Thank you to the hospital. Like in all the other cases, we've done expedited traces throughout. So those individuals that had within CDC guidelines who were supposed to be notified were notified on Sunday that night. We also, again, closed down that area. We did a professional cleaning, both fogging and wipe downs as prescribed, and having professionals come in to do that cleaning is paramount. We've also, again, in all our facilities, we've had our health assessment professionals going out weekly to all of our sites, making sure we continue to follow the CDC guidelines. making sure our food employees are wearing face coverings. They have their protective gear on. Those who are on the registers are not handling food, and all those other prescribed plans. And again, knock on the table, but thus far, with all the cases that we've had across the installation, once we've done the cleaning, we have not seen another case pop up in that same area or in that same building. And so that's just a testament of the procedures that we're following, the procedures that the health or the cleaning crews are doing in those areas. And again, my hat's off to our Task Force Clean and our contractor who is doing that cleaning for us. And so again, that's the one case I want to highlight today. Again, I want to turn it over to Captain Judy to provide us an update and address some of those questions that you had for the hospital.
All right. Hey, good evening, everyone. Thanks, Colonel Greenberg. I always start out each week with a few thank yous. And so I noticed that Garrison recognized Jennifer Wilbraham and her daughter Catherine for making masks and distributing those cloth face coverings to soldiers earlier in the week. And I just wanted to extend that. I think that's a really, really great initiative that people have done. And we at the hospital have gotten a lot of masks as well through the Red Cross and the Million Mask Project and individuals and groups who have donated. And so I just wanted to share with people what we do with those. We've given quite a few to staff, right? But we also give them to patients when they come in. So if somebody comes in and they're maybe wearing a bandana or a disposable face covering, we offer them one of those masks. And so the overwhelming response has been very positive, and I know that a lot of people make these masks, but they don't ever get to see the joy in somebody's face. And so thank you for all of those incredibly creative masks that you've made. We really, really appreciate them. The other thing that I wanted to share is that there are a lot of children who are doing a lot of things for COVID while they're at home, right, in addition to all of their homeschooling. And as I've made my rounds throughout the hospital, there's one picture in particular that I have discovered at every nurse's station and on just about every bulletin board throughout the hospital. And so I actually brought the picture with me, and I wanted to share it. I don't know who Sophia is, but Sophia, I just want you to see that we really, really appreciate your picture. It has made a world of difference. It's in the emergency room, it's in the COVID clinic, it's on the inpatient units and in the outpatient clinics, and it's really, I see it everywhere, and I just want you to know, Sophia, that you've made a difference at Fort Belvoir Community Hospital, and we're super appreciative of that, so thank you. A few updates. You talked about maybe a little bit of stress going on with all of this as we've changed the way we seem to be living life right now. And I just want to share with people that there's all kinds of care that's available at the hospital. Although COVID has changed the manner in which we deliver services, appointments are still available, and we continue to see about 2,000 patients a day. We do it a little bit differently. Some of those are in person and some of those are virtual, but we are still delivering outpatient services in addition to all of the inpatient and emergency and other services that we deliver. So if somebody has a need for care, they need to reach out, and we will be there to support them. The CDC updated their guidelines. I don't know if everyone was aware of that, and so many patients with confirmed COVID have developed fever and or symptoms of acute respiratory illness like coughing or shortness of breath. But the CDC updated their guidelines regarding symptoms, and they've added a few more. So some people may present with other symptoms, including chills, muscle pain. A new loss of taste or smell seems to be the one that gets a lot of attention in social media and everywhere else. Lots of people are reporting new loss of taste or smell. Vomiting, diarrhea, and sore throat. So just be mindful. The CDC advises everyone to kind of, I don't want to say self-police, but as you're wondering, should I be tested? Those are some of the symptoms to be on the lookout for if you start to feel ill. Okay. Another thing that came out yesterday was the Virginia governor announced in a press conference that he plans to ease restrictions on elective surgeries and dental procedures beginning tomorrow. I've gotten a lot of questions about at the hospital about that today. And so I just want to be clear, he made that statement, and then he also directed that facilities develop and implement guidelines to ensure the safety of patients and healthcare workers while maintaining adequate supply of personal protective equipment. So at Fort Belvoir Community Hospital, we're working with the National Capital Region on what a recovery plan would look like for COVID. That's obviously going to be a phased recovery plan. And by recovery, I mean recovery of services, not recovery of patients, okay? We will continue to do all of that. But that phased reopening plan or recovery plan will mean that we're gonna bring back services in the future. It's not gonna happen as quickly as May 1st. And as we reopen those services, I'll update you through these town hall meetings as well as on our webpage and our social media sites. So more to follow. But we're working on that plan for the entire National Capital Region to see when we can start bringing some of those back. But certainly dental procedures and elective surgery are up there on the forefront of our mind. So, other than that, there was one question, that was a very simple question, which was how do I contact the EFMP program during the COVID operations? And the answer to that is our phone number for EFMP, or the Exceptional Family Member Program, is 231-1054. I'll say it again, 231-1054. So those are my updates for this week.
All right, well, thank you so much. And so just a couple other things before I introduce our special guest for today. So first, you know, Captain Judy talked about the recovery plan or our transition plan. I know someone last week or someone posted that they don't like the new norm because it's not a new norm. We're gonna go back to what the normal is. I'm gonna continue to use the new norm, and this is the reason why. Is I believe, again, this is my belief, that we will be in a HPCon alpha stage or an increased stage for the next couple of months. Again, I can't say it's 3 months, I can't say it's 5 months, I can't say it's 2 months, but there is going to be a plan, just like a recovery in the hospital, there'll be a recovery in the community as well. And so even though we go back to operations and we start opening up, we got to expect that opening up means different than what it was in the past. So one of the areas that people have asked about is our child development centers. And I'm not gonna put any dates out on the calendar. We are working on a transition plan, but you'll notice in all our transition plans and all our plans that we put out, there are no dates associated with anything opening or anything going back. What is associated with are conditions that are happening. And so a lot of our triggers and a lot of our conditions are based off of our health protection conditions. And so when we go to health protection Bravo, which is triggered by cases in the area, there's a lot of factors that go into when we will decrease our health protection conditions. But that is the conditions that will trigger activities coming online on the installation. And so, and just, I know people have some time at home or want to read stuff by themselves. And so I'm going to reference a couple of the things that we're using. Okay, so the White House Task Force has put out a Opening Up America Again. It's on the whitehouse.gov page, and I believe Public Affairs will put a snapshot out of that. But again, if you want to know what America is doing to open up, you're more than welcome to read that material. Also, the CDC has put out in the last couple of days guidance for cleaning and disinfecting public spaces, workplaces, businesses, schools, and homes. Okay, and so again, this is what Fort Belvoir is using, but also what the Army is using as we assess and we go back to what our new norm or what our conditions will be in the future. So again, two pretty good documents that we're using. And so for our child development centers, I had a question that I'm incorporating into this portion. And the question was, my husband is active duty and I'm a working civilian spouse. Basically my business is asking me, or my companies are asking us to go back to work on May 4th. My husband works full-time and I'm expected to return to work as well. When can we expect the CYS CDCs to open back up? And I think that's a question that's happening across the board. And so although I can't give you exact timelines, I want to give you some expectation management. So the family that asked that question about May 4th, I will tell you, if you're not a part of the vital workforce right now, that you really need to find a alternate daycare facility. Because by May 4th, expectation management is we will not be up to anything more than we are right now unless something significantly changes in the next 5 days. Okay, so that answers that question. But just in general, again, we have to take, as we're opening up our child development centers, we really have to take into consideration the protection of both our children and our staff. And again, that's our primary objective. And some of the guidelines out there is social distancing and the limits that we can have in each of our rooms. And so although as we go back to opening all our child development centers, and we go back to what we had said the capacity was in each one of those child development centers, please keep in mind that with the social distancing and other areas, we also have staff that are high-risk individuals that also won't be coming back to work until we get down to a lower health protection condition. And so in the coming months, even when we go back to what a normal would look like, our capacity at our child development centers will significantly decrease. And so I want to put that out there to you. And as we go back to those conditions, right now we have vital children that are in our child development centers. We also have a couple hundred folks that are also mission essential that are not in the CDCs. So as we increase the capacity of those, those mission essential children of both parents are really going to be what the next priority is, along with our child care workers who have children, and then followed by our active duty, dual military, and then our single soldier military. Okay, and then from there, then we would expand out to additional families. But again, for expectation management, that process will take some time. And so if both parents are telling you that you need to go back to work in the next 2 weeks, then I would say you may need to look at other alternative daycares. And since we're talking child development centers, let me just talk about our family child care providers. And so on the installation, we also have what we call family child care providers, and it's really families that use their house as a daycare center for the community. And we have a handful of them right now. But due to the critical need for viable child care options during COVID-19 and beyond, we're recruiting individuals who live on base housing to become licensed family child care providers. And so Child and Youth Services, CYS, would like to invite any military spouses living on Fort Belvoir to become a family child care provider. And applications can be sent to them. We would expedite those applications. And then we would, the benefits of this is really working from home, excellent training opportunities, managing your own business, and becoming a part of a great team. So if you have questions in becoming an FCC provider, please contact the Family Child Care Office at 703-805-1824. Again, 703-805-1824. I also just want to remind you, unauthorized child care is defined as anyone living in government-owned, leased, or privatized housing, providing children for more than 10 children, providing more than 10 child care hours per week on a regular basis, who is not certified under the Family Child Care Program. And again, if you have questions on that, as we get into the weeks to come, we'll continue to put more guidance out on child development centers. The next thing I want to talk about is our post-exchange. And so you've probably noticed at the commissary we are doing enhanced screening. We're doing temperature readings at the door. We're also checking IDs, and we're asking those enhanced questions. We've also set up the same operations at the post-exchange main exchange areas. We are doing temperature readings. We are doing enhanced screening. We are also checking military IDs, or IDs, not necessarily military IDs. Understanding that, again, that main exchange is open access for the concessionaires that are outside the post-exchange, to include the food court. But the reason why we're asking for IDs is we want you to take responsibility for your actions. And so irresponsible actions, we need to know who you are. And so if you go in and you don't have a face covering, and you decide you want to still go in and continue to shop or go around and not have one, and you've told the front screeners that you're going to get one, we want to take your name, we want to talk to you and figure out why you don't have responsibility for your actions. But again, the theme has been all along in these virtual town halls that it's all of us collectively, all of our responsibilities to protect our community. And so again, the face coverings that we're wearing is not really to protect you, although some that have the filters could protect you, not 100%, but can protect you some. Those face coverings are to protect everyone else out there. And so if you do not know that you have COVID-19, or maybe you are not feeling well, and you haven't been tested yet, and you cough or sneeze, your germs get on hard surfaces or they're airborne. Those face coverings are to protect those areas so it does not spread. So again, I ask you that take responsibility for your actions. Please put face coverings on. And I continue to drive that point home. I want to make that point clear again. The next, a couple of the others that have been out there for a while, haircuts. The question has been when are we going to open our salons or our haircut places? Again, today I'm not going to tell you a date that we're opening it, but we are getting closer to that option. Okay, so it could be here in the next couple weeks. But what I would tell you is, again, the new norm will change until we get down to a lower level. And so when you thought, hey, I can go into a barber shop and get a haircut, and it was very easy, it may be a little bit more inconvenienced. So look at things such as extreme social distancing, protective face coverings on for everyone, the extensive wiping down of equipment, appointments only. Again, working through that process. But again, if you read some of the literature from some of the governors out there, like Maryland, they're doing appointment only. Looking at that here on the installation. But again, that's just one example of where we'll go to in the future. Also for haircuts, looking at active duty and first responder, those jobs that require the grooming standards up front. Again, a lot of us, to include myself, have needed a haircut for several weeks. Some need it for a job, some just want it because they want the haircut. But again, as we open up the barbershop, again, there's going to be a priority on those who need it first for the first week to get everybody through the system, and then opening up to more of a general population. Okay, the next thing I want to talk about is tomorrow is Law Day. And so the essence of Law Day is your vote, your voice, our democracy. Again, this note will go out on Facebook today when I get done. But again, if you read the letter I provided, you can hear the story of Susan Anthony and 14 other women who were arrested for their crimes of voting. And I go kind of into their storyline. But at the end of the day, the bottom line for the Law Day, I urge you to reflect on the Constitution and its concepts of equal protection and what that means for our natural, civil, and political rights. Resolve to use your vote to make your voice a part of our democracy, and in doing so, give to your privileges as a citizen of our great nation. And so again, that'll be out for your reading pleasure. Okay, so last week we had the school liaison officer come up and talk a little bit about what she's doing for the community, and each one of these weeks we're going to take an opportunity to bring a special guest in, just to talk about an opportunity of what they're doing to help our community out. And today I have a distinct privilege and honor to invite one of our coworkers, the principals of our elementary schools, and we have a very unique opportunity. So Miss Jamie and Miss Margot will come up and talk a little bit to the community. But again, here on Fort Belvoir, we have a Fairfax County school that operates on the installation at large, and so a very unique opportunity. But again, they don't have to be a part of our garrison, but they elect to be a part of our garrison. And so if you didn't notice, over the last 18 months in my command, I've been very active with the schools, and the installation has been very active as well. And so they are truly professional. They want to do great things for our community, for our children. And so I'm going to give them the opportunity to discuss some updates. So the floor is yours.
Thank you so much. I am Margot Preja, the principal at the primary school, and this is Jamie Chinetta, the principal from the upper school. And we are so appreciative of the relationship that we have with Colonel Greenberg and with the garrison, and the fact that He views the community and the importance of strong families and a strong community, and the school being a part of that. We have been, this is our second year as the principals here at Primary and Upper, and we are so fortunate and blessed to have that relationship because we really feel like it makes us all better when we're all working together. And so the first thing we want to say is this is really uncharted territory for schools, and every school across the nation and really across the world is grappling with the same kinds of issues. And I think I see postings on social media, and the level of stress that our families are feeling is just through the roof. And so the first thing we want to say to reassure you all is that we absolutely in no way expect you all to be replacing teachers. That you are parents, and I think you're feeling this, all of the responsibilities and the duties that go with being a parent. Many of you are working from home and trying to manage the schoolwork. And so we want to put your minds at ease that, again, it's not our expectation that you are recreating the entirety of the school day, because that's not possible in a distance learning environment. What we are trying to do is maintain your kids' connection to their classmates and to the teacher especially. We're trying to maintain just their active thinking, but we just want you all to give yourself a little bit of grace, and you're doing a great job, and this is very, very difficult, and you have lots of things that you're balancing, and there are tons of resources out there, and that is sometimes a blessing and a curse, that you look and you feel a little bit overwhelmed by that. And the resources and all the packets and all the videos, and those are meant and intended to be a support for you all and not to become a burden for you and your family. And so we just hear families grappling with, multiple kids trying to, this one is online for this time, and then this one has office hours, and then we have the packet, and like, how do you do multiplication? Because it's different than when I was in school, and all of those things are true. And so we just want you all to know that you're doing a great job, and we hear the feedback from you all. And you are the best person to know the unique needs and the unique circumstances of your family, and to make decisions about, of these resources that are out there and available, which ones make sense for my family right now, and which ones might we hit the pause button on, and it's okay. It is absolutely okay to do that, and we just wanted you all to hear that from us, first of all, because we know that people are very, very stressed. And our kids are older, and it's a very different beast when you have teenagers. Like, you have to wake them up at 10 a.m. But with little ones, they are ready to go, and so you are managing a lot. And so we recognize that, and we just want you all to know that you're doing a great job. A couple of things, certainly the rollout of distance learning, that's kind of the elephant in the room. It did not go in any way as we would have anticipated and hoped, and we know we had people trying to log on and couldn't get logged on. We had kids upset because they were excited to see their teacher and they weren't able to do that. We do think from a technical perspective, we worked out all of those kinks at the district level. We had a really successful week. We didn't hear any issues around the technical parts, so we were very grateful about that. But we would be remiss if we didn't give a shout out to our teachers. In spite of all of these glitches and difficulties, and we kept calling them together for a staff meeting to say, and now we're doing this different way, and now it's going to be different. And felt like every time we brought the teachers together, and they took it in stride, and they were, if the technology didn't work, they were calling parents, they were emailing, they were using the Remind app or Class Dojo, or they were communicating and making sure that they maintain that connection with you all, your family, and certainly the kids. And so we definitely are so appreciative of our teachers. Next week is Teacher Appreciation Week, which is very, very appropriate because we are so appreciative that they really are the ones that kind of were the glue that held all of this together. So we definitely appreciate that. We also appreciate feedback that we've gotten from you all, that this is new. This whole structure of school is very different than in our own educational experiences, and in our professional experience is so very different. And so you all gave us feedback about which parts of this are working and which parts of this aren't. And so, for example, the wonderful fourth grade team at Upper had created this hyperdoc that was so clearly laid out, and we heard from parents, gosh, that really makes sense for us. I know what my kid needs to do. They know what they need to do. And so a member of the fourth grade team came and presented to the primary staff to be able to, and so now we've replicated what fourth grade was doing at the primary school so that it's clearly laid out. And that's based on feedback we got from parents. Parents said this part of it is making sense to us, and so we were able to be responsive to that. So we do appreciate the feedback, and it helps us to get better, and it helps us to know what's working for you all and what's not, because we don't have that face-to-face contact. A couple of other things before I pass it to Ms. Chinetta. We did send out a survey. We just want to check in. We want to see how are you guys doing. There's how are you doing with managing the logistics of all of the schoolwork, the technology, and then how are you doing as a family in terms of managing your stress level. We just sent it out yesterday, and at primary alone, we've already gotten over 100 responses. So we really appreciate that. We encourage you all to give us that feedback because it helps us to know where there might be gaps or how we can connect you with services. The other piece is registration is still open. We have families that are moving in and they're not quite sure. They feel like they're trapped in limbo. And we want you to know you can reach out to the school and we can still register families. If you move out of the school district, then you are still able to access the learning packets. And so we would just need to change the address on record.
Thanks, everybody. Margaret did a great job. Student registration is open, and we hope that you will let us know. All you need to do if you're new to the area is to call our schools. I know it seems odd, the schools are closed, but we have our phone numbers and the main office is forwarded to our home phones. So our administrative assistants are getting your calls. If you call the school to leave a message, our administrative assistants will receive your call and they can put you in touch with our registrar so that we can get new students registered. So don't hesitate to call us. If you need us, we can get that call to the right person who can help you with your question. We know there are a lot of questions about families who will be moving soon and they want to return library books or band instruments, and we don't yet have permission to do any of those things, but please know that our central office folks are working really hard to come up with protocols that will allow us to return things to the school building and for us to get those things back. So hang on. If you are moving tomorrow, call and we'll get that message and we'll figure out a way to get those things back. But if you're moving in June, just hang on, or July, because we should be getting those protocols soon from our higher ups so that we can facilitate the safe return of equipment and get things back to you. Okay, so student registration is open. As far as what you need to know in this new structure is good. If you can, some parenting tips. We don't mean to tell anybody how to run their families. We're still trying to figure out how to run our families, let me tell you. But structure is great. If you can figure out a schedule that you can kind of keep to at home where you have a normal flow of your day, that does tend to help with keeping everybody on track with who's supposed to be online at a specific time. I can tell you at both primary and upper, we did stagger our learning schedules so that families could share resources. We know that not every family has a laptop per child or even a laptop in the family, and so we have staggered our learning times so that multiple children can get on at different times. We also have laptops. If your family does not have access to a device at all, or you have too many children that have conflicting times and there's no way for a child to get on live at the time that their teacher is on, please do give us a call at the school. We've distributed over 100 laptops between Fort Belvoir Primary and Upper in kids in grades 3 through 8. We don't yet have the ability to distribute laptops for our students in kindergarten through 2nd grade, but if you have children in grades 3 through 8, we can help you with that. So if you need a laptop in your family because you don't have one already or because too many children have conflicting learning times, please do give us a call and we'll do our best to get you a laptop. Yes, so I know the learning links have been a little bit tricky. Third time was the charm. We had such different ways that we had children accessing learning, and we had a couple stops and starts, but we feel really strongly that we're in a good place now. This third week has gone really, really well. We haven't had any issues with connectivity, and we're super excited. Our teachers are thrilled. But please know that even during all of this time when we've had some difficulty with kids logging on, there have always been assignments. There have always been work for children to work on. There have been videos for them to watch. There have been other things, but what they missed was the most important part, and that was that live connection, because we know what the live learning is. It's not that they're going to learn everything they need to know in the 1 hour that their teacher is on with them in the morning. What's important about that time is that building of relationships, that continuing of relationships with that teacher and with their friends, and so we know how important that time is for the relationships. So please know we're thrilled that we're back on, and we're back live now, and it seems to be working a little more regularly. So your teachers are there, and they are so excited to have their children back in their fold. As far as all the learning experiences, I think Margot explained it really well. Just do the best you can. If your children can just do the learning packets that they're getting in the mail, it's going to be okay. If they can access any of the learning on television, on Channel 21, it's great. It's the school system has identified the most essential objectives for these last few weeks to help kids maintain their learning for the year and to prepare for the year to come. And we are presenting new learning. Just know that we're doing they all kind of go with each other. The packets go along with the what's going on Channel 21, which is going on with what's being presented by teachers and live learning. So it all sort of feeds together. So do everything that you can, and please don't feel guilty if your children need to miss time. It's okay. Do what you can. So we do have Channel 21 working for us for elementary, Channel 25 is for middle school, Channel 99 is for high school, and those do have links right on FCPS, the FCPS homepage if you don't have cable and get those channels in your normal cable system. We also have technical assistance. If you borrowed one of our laptops and it's not working just right, just let your teacher know. And if they can't help you with that, we do have a technical person. Pam Day is her name. She's the same person for both buildings. She's at our campus on Wednesdays to repair laptops if we have any laptop repair needs. So do reach out to your teachers if you have any questions about that. Please know that food distribution continues to happen daily at our school. Every day from 10 a.m. until 1 p.m. If you have a family that needs, you'd like to pick up breakfast and lunch, they are there for you every day. So we hope that you'll come by. Did you remember what the number was? We looked at that before. I don't remember. It was a really big number of meals that the county has distributed so far. Over 600,000. And certainly thousands of those, or a few thousand anyway, have come right from the Fort Belvoir campus. So we're thrilled to be able to provide that service to our families. Also, we wanted to let you know about Mission Bounce Back. It is a newsletter that our clinical team has put together, our social worker, our psychologist, our counselors, our MFLACs. They have got this great resource that they're putting together monthly called Mission Bounce Back, and the publication is right on our Facebook, or not our Facebook, it's on there too, but it's also on our web page, our website. So there's a new issue right now, really great stuff about how to structure, how to handle conflict, especially conflict between siblings, and boy, I know a lot of us can use that article. Thank you, Ms. Hill. We also have some articles on guiding children through a digital world. Our MFLEX provided that. We have some other parent resource links for you, and a review of the zones of regulation, which is some language that they learned during the school year that your children know, and it will be helpful to you if you use some of that language at home, okay? So that's the main gist of what we wanted to share, and we're open to your questions.
Okay, thank you so much. Okay, we're going to continue to move forward, and then if there's other questions from out there, we'll gather those up. So I'm just going to go through some of the unanswered and unanswered questions, and some of the other questions that have come up in the last couple minutes of this forum. So the first question was, can we expect frequent town halls in the future past this pandemic shutdown? And the answer is yes, not as frequent, but potentially monthly community town halls in this forum is something that we're looking at in the future. Another question of what's going on in the 500 block buildings. We've talked about it in one of the last town halls, but again, that is a quarantine and isolation facility that we have set up, primarily not for medical care in there, but that is a place for folks who are quarantined or isolated who do not have a house that has a separate bathroom, separate bedroom, or for service members who are living in the barracks who need isolation or quarantine. Another question was, what about opening up of gyms, basketball courts, skate parks? Again, I gave you some of the literature that we were looking at as well and digesting. I can tell you here in the next, I would say 2 weeks, we will have a transition plan or a rollout plan for the community as we do a conditions-based phased approach of opening back up the installation. But again, basketball courts, outdoor skate parks will be one of the first things that we're looking at opening up as well, along with the golf course and some others. As Mr. Henschel comes up to talk installation and access, just a couple other things. Now I'm going to let Frank go ahead and you answer your questions, and I'll move on to the next topic.
Thank you, sir. As the commander mentioned, there's some questions regarding installation access. The first question in regard to installation access is, can the exit out of Lever Gate be opened? It's easier going south on Route 1 when leaving. And a second question was very similar, asking that J.J. Kingman also be opened. As we don't have a date right now as to when we're going to open these gates, as the commander has mentioned, we're in the planning stages of our transition plan on the installation. In short, we hope to be able to open some additional gates in the near future. The next question, are taxis, Ubers, and Lyfts allowed on the installation? If yes, what are the procedures? And the answer is yes. Ubers, taxis, Lyfts are all allowed on the installation. They do, however, have to come through the Tully Gate entrance, use the commercial lane, and be treated like a commercial vehicle. Next question, why did we switch from Lever to Tully? We've had this question before, and as the health protection conditions changed, the garrison determined that Tully Gate would be a better suited for any possible access control changes. Last question, with the DMVs being closed and the Department of Homeland Security has announced there would be further extensions to the Real ID requirements, would it be possible to reevaluate the requirement for Real IDs for visitor passes? The answer, the proponent or the authority to reevaluate the Real ID requirements is the Office of the Provost Marshal General. And to this date, they have not altered or changed this requirement. But please remember that you can use a birth certificate or a social security card, and that would suffice. Sir, that's all I have.
Okay, great. Okay, one of the questions for Captain Judy, can the hospital pharmacy fill refills now?
So the hospital pharmacy, the key to that really is just activating that prescription in advance. And so normally refills are done at the PX pharmacy, but I know that in some cases when people are activating that prescription in advance, they are using that curbside pharmacy to do some refills. So that's something, if you use that phone line to activate your pharmacy, you can have that discussion at that time.
Okay, great. One of the other questions that came up, what steps are taken to clean facilities? And I will tell you, again, we have had very effectiveness with the cleaning. And so we will continue to use those processes of fogging and wiping as the professionals are doing with positive COVID cases. For your houses and your work areas, again, I highlighted the CDC guidance out there. Again, please read that for your areas that you maintain at your house. There's some really good guidelines on there. Mr. Rennick, if you want to come up, you have a couple of DHR questions?
I do have one.
Okay.
I have to respond to. Good afternoon all. Kevin Rennick, Director of Human Resources. So the one question I have today to answer to is the passport office open? Well, during COVID-19 and under current HPCon conditions, the Fort Belvoir passport office is closed. However, you can go to the Directorate of Human Resources homepage, click on the Military Personnel Division, and within it is a link for the passport office in which you can address your concerns, and also you will get updates on the current passport process. Thank you.
All right, great, thank you. Okay, just a couple others. One from the commissary. Again, it's the same question as last time. Can we put one-way traffic out there? Again, the answer is going to continue to be no. We're going to continue on the way we are going. Again, what I would ask you for, and there were some other sarcastic comments about 20 people in an aisle and someone coughing next to someone else. And I got it. If that happened, that's absolutely wrong. But again, we need to use common sense. So if you see 20 people in an aisle, then that's probably not an aisle that you need to go down at that time. Skip the aisle and come back to it. But again, the aisles are very well marked. We are limiting folks in the commissary. We are seeing a lot more folks coming in the afternoon, evenings. So thank you after a couple weeks taking the advice. As I see someone in the commissary, a couple people come up to me and said, thank you for the advice of coming in the evening, it's much better. And so again, I advise you, if you're coming in the morning and you're sitting outside or in line, and you have time in the afternoon or evening, please go to the commissary. Again, it is a lot less busy at that time. All right, do we have some questions from outside?
Yes, sir. This question is for the elementary school. Is the elementary school still planning to move the schools this year?
Yeah. So the question is the elementary school still planning to do the switch of the buildings this year?
Yes, thanks for the question, and the answer is yes. We are moving full steam ahead. There's an RFP out now for the movers, and our central office folks are heavily working with us to make sure the move goes really smoothly. We're excited that, and actually in some cases it'll be a little easier because we don't have as many people in the building right now, so we can move forward with some of the things that need to get done in order to prepare for the move. But yes, we are planning to, we're moving forward full steam ahead.
Okay, any other questions for the principals?
No, sir.
Okay, any other questions?
One more question.
Okay.
For DHR, when will the education center open?
Great question, and I will follow in the footsteps of my colleague. That is something that we, as the Garrison at large, are working on. We are establishing a reverse plan, and as soon as we get that established and finalized, that information, will be put out to the community. Thank you.
And the question was, when's the education center going to be open? Again, there will be a full rollout plan. Again, not with dates per se, but based off of conditions and based off of phasing. And so just to expand on that, so as we go down and we lower the health protection condition to Bravo, that doesn't mean everything that we are planning to open in Bravo will be immediately opened. That means, the first week we may open at a certain capacity and then expand it out. Any other questions? All right, I'm going to turn it over to Captain Judy for any closing remarks.
The only thing, there was one other question that was out there that was, how come Fort Belvoir won't test patients a second time to see if they're still positive? And really the answer to that question is the test is used to diagnose a patient to see if they have COVID, but what the test doesn't do is it doesn't tell you whether or not that person is still infectious. So the CDC has recommendations for when to release somebody from isolation and quarantine. And the majority of people can discontinue quarantine using that time-based method. So fever-free for 3 days, right? It's been at least 7 days since that positive test, and symptoms were onset, and improvement of those symptoms. That's the best way for somebody to be released from isolation or quarantine.
All right, great. Any other closing remarks?
No.
Okay, so hey, thank you again. Thank you for everyone who's supporting the installation. I can't say it enough. I say it every week, and I'll say it again this week. We have people who are maintaining this installation, allowing things to run. The first priority is protecting our people, our community, our workforce. Second priority is mission assurance. Again, allowing our units and our operations to continue on, which we've done throughout this entire pandemic. And then third is working and contributing to the whole of government approach. And what many of you may not know is Captain Judy and her staff, a lot of her service members are deployed forward into New York City and other places to really help out with other communities. And again, that's the third priority. And we're doing that here on the installation. So everyone who's out there who's helping this installation run, thank you so much for what you're doing. Again, thank you for all of the community for listening in to these town halls. Hopefully they are useful. Again, a closed caption video will be posted on our Facebook page like in the past. I ask you, and we've highlighted it every week, to make sure you're adhering to the policies and remain vigilant for your actions on this installation. Because again, only us together as a team can we ensure safety, health, and welfare of the entire Fort Belvoir community. Again, thank you for your participation and feedback. If you have feedback, please reach out to the Public Affairs Office, and we can take those into account in the future. Remember, we are all in this together. the longer we stay at home and apart, the sooner we will be all together. Again, thank you for your participation, and we'll see you next week.